Dr. Laura Garcia, healthcare educator, frontliner, hero. Born in Butuan City, Philippines, Laura Garcia's parents, Jose and Teresa, were both teachers who came from Ilocos Sur and settled in Mindanao. Their family had two passions, education and careers in health. Dr. Laura was destined to fulfill both, first as a nurse and then eventually as a nursing professor. Dr. Garcia is a graduate of Silliman University College of Nursing, later completing a second bachelor's degree in communications at Kean University in the US, where she graduated summa cum laude. Later, she earned 2 master's degrees in nursing and finally completed her Doctor of Nursing Practice degree at Farley Dickinson University in New Jersey. As a Filipino-American immigrant to the US since 1985, Dr. Garcia has devoted herself to comprehensive patient care and to the instruction of newly minted nurses, the 2 pillars of her professional life. She considers her students as a source of deep inspiration. Some of Dr. Garcia's notable contributions as an educator and alumna of Silliman University are: she was instrumental in the launching of the Silliman University Honor Society in 2014 and its chartering as the Psi Beta chapter of the Sigma Theta Tau International Honor Society of Nursing, or STTI. She is actively involved in the professional organization Philippine Nurses Association of New Jersey. She served 2 terms as press relations officer and 2 terms as board member. She organized a lobbying effort to reach out to Governor Cuomo of New York and disseminated newsletters to the community to argue against the closure of the historic Long Island College Hospital School of Nursing in Brooklyn. Dr. Laura is also active as state chair of the National Federation of Filipino-American Associations of New York. As an educator of healthcare frontliners, Dr. Laura Garcia has helped staff the PhilAm frontlines and first responders to the COVID-19 crisis. Dr. Laura Garcia also reached out to Mayor Bill de Blasio to recognize the PhilAm frontliners for their courage and bravery to help patients afflicted with the recent coronavirus. The result of the request is a video that New York City released to the public during the Filipino-American History Month in October.
More than a quarter of the immigrant nurses in our country are from the Philippines. So it's no exaggeration to say we literally would not have survived the COVID-19 pandemic without all of you, our Filipino brothers and sisters.
The courage of our frontline healthcare givers is theirs, but underlying their courage is the care and professional training they received from the likes of Dr. Laura Garcia.